morning, Jamie. Thank you for being on Burst TV, everybody. This is Jamie Dooley. Do you go by Jamie Freitag Dooley or Jamie Dooley?
Jamie Dooley.
Okay.
Freitag is hard for people to remember and spell and pronounce.
But it's actually easy for me to remember because it's kind of sing-songish to me.
Oh, well, it's Friday in German, so that helps you know how to pronounce it.
Oh.
But growing up, no one ever said it right.
Oh, everybody likes Friday, so
yeah,
it's a good way to remember your name. All right, so you are a busy lady. And it's kind of incredible that you have something going on that we're going to talk about today. You are the executive director of an organization called the National Network of Healthcare Hygienists.
Yes.
And this is new. How newish? Like last year?
Last year, yep, we got our 501c3 paperwork really fast. We weren't expecting it to come through quite that fast, so we feel a bit behind. Yet, as all new nonprofits are, we're grassroots and we're still a startup.
So, what is a healthcare hygienist? Because I have in my mind what I think it is, and people are doing that already. But
yeah,
according to you and the organization, what is a healthcare hygienist?
So we're already healthcare providers, but we're not viewed as such by the medical community. So the mission or goal of an NHH is simply to infiltrate hygienists into healthcare systems and be part of a collaborative care team. Hopefully every collaborative care team by 2025. So a healthcare hygienist, we're not going to really define what it is because within different states and different systems, each hygienist is going to have very different job duties, and based on her background and which field of medicine she's specializing in, he or she, get the hygienist in there, he or she is going to be probably growing every single day, and their duties and their systems and processes that they're creating and helping implement are going to grow too. So our goal for NNHH is to support them as they make this transition. And really, we're not thinking of it as leaving private practice or dentistry. We're just thinking of it as more of us, maybe 10% of us, working within the healthcare world, bridging that gap. And communicating with the dental world, because that's really what needs to happen. Is the communication needs to be established, the referral systems, and who better than us to be that person.
Right, and I've taken liberty to make a few phone calls to medical practices, and it was always the side eye, kind of like the stay in your lane.
Yeah.
And I'm like, wait, this is my lane. Like this
Exactly.
is totally like I'm seeing a reason why this person needs to come see you and get reevaluated. So, and I don't, could be just a regional thing too. I'm in Florida. Sorry, everybody, but we're a little backwards on some of this thing. We're a little behind the eight ball. But there are so many hygienists that need this, that are very eager to get more involved. So, and I like the word infiltrate.
Yes. Boots on the ground.
We're trying. We're really trying to get in there.
We are. We're doing it.
Absolutely. You are paving the way. So on a technical level, like what are some of the things that you'll offer to help pave the way, to clear that path so that hygienists can be more?
So in 2020, our goal is our very first certification. So one of the main objectives of NNHH is to help hygienists specialize. We're talking about, think of it like one college course. Instead of going back, which we do support you going back to school for your bachelor, master, or doctorate, but that's not in the cards for everyone. And so if you already have a specific demographic that you like to serve, that you feel called to serve, that you have a lot of knowledge in, whether it be dementia or airway or cardiac, whatever, peds, ER. I mean, there's so many different ways we can specialize.
So would you have different certifications for those?
We would, yes.
Oh, that's
absolutely,
exciting.
Absolutely. But in 2020, our goal is to create our first. And because we want to be an accredited certification system, an organization, because hospitals all have to meet strict accreditation standards, we have to go a bit slow, and it's very expensive. So in 2020, our goal is to put out our first. We would love to put out two. But if you take a look at nursing, they have, I think, 4 or 5 different organizations that offer certifications for them. they can specialize. Medicine got too complicated. It was too difficult to stay up to date on the standard of care. Best practices were just out the window because you could barely keep up on what's the least I'm supposed to be doing in this
Right.
area. And dentistry is really no different. It's really, oral health has gotten that complicated too.
So how do you get that certification recognized so that like a doctor's office or a hospital would say, oh, that's great. I can recognize you because you have this certification. Where does the meaning come from, that value?
The meaning comes from being accredited. So there is no hygiene specialty board right now or hygiene specialty organization. We intend to be the first that's specifically certifying hygienists. And we know, in fact, we hope that other organizations will be created and come forward as well, because this is needed. And we can't possibly cover every area of medicine and keep everyone up to date. We're just going to do our best to be the first and to be the organization that you can count on when it comes to quality.
This is very exciting. So to take from your website, I quote, "We educate, coordinate, prevent, and refer. We are the primary care providers of dentistry, and we believe we can help healthcare systems save money and improve outcomes."
Absolutely.
Who watching this would not want to see that happen?
I get chills, right? Like
Yeah.
that's where we belong. And I'm not saying all of us. There's probably going to be about 10% of us. I'm thinking 1,000 of us in the beginning here. We have a very active free Facebook group, Hygienists in Healthcare. And I think there's 1,400 in there. So these are the people kind of watching. They're the people that think, gosh, my body hurts. I had to quit hygiene because I was dropping my scalars. I could not practice any longer. So all that knowledge that's sitting in my brain, right, can be utilized in just a very different way when it comes to working in a medical system, creating systems and processes.
Now, one of the big things that you need to have happen right now is membership, and you're having a membership drive. So can you tell us a little bit more about that? That's what prompted me to have this conversation and have a sense of urgency to get this message out to not only our burst community, but everyone in healthcare and in dentistry to help us get some collaborations going. So tell us about that membership drive.
So we just launched our first official membership drive. It's the month of January. So January is almost over. There is a chance it will extend. That will be up to the board. I am not a voting board member. I just am the executive director. So I'm not certain whether or not membership will be open again this year. I'm guessing it will be, but you have until January 31st for this drive. And the question is, well, who would join? Anyone that has a passion for integration. Even if you want to stay working within the dental world, having some of these medical certifications, especially in the one area that you're the most passionate about, maybe diabetes. Maybe you really want to start testing for diabetes in the office. Well, when you do call that physician, that provider, like you said, you can introduce yourself. You can start to really build some referral networks and start to establish really deep relationships with these providers and make a difference.
Patients are starting to learn about the oral systemic link. So I think it's our responsibility to make sure that we can be that collaborative.
Exactly.
It's super important.
Exactly. Our goal is to be a bridge. That's all.
Yeah, that's it. Thank you so much, Jamie, for coming on today. You guys, if you have questions for Jamie, you can always leave them in the comments, and I'll make sure that she can answer those for you. I'll leave in the description the website. Like I said, it's the end of January already, so if you're interested in supporting this cause, and the board members, you have 5 or 6 board members?
I think we're up to 8.
8?
Yeah.
Okay, so
people are so passionate and they're so excited about this.
It's growing very, very quickly. I'm very excited to support you guys.
And thank you for your membership, Charlotte.
Oh, you're welcome. I'm always the one to just push the button. I'm like, yeah, this sounds good. Let's help them.
And we need that kind of support. Even if you don't know that you're going to do anything else, if you can throw a little bit of membership money our way, we're going to support you when you're ready.
And pave the way for future hygienists. Just
Absolutely.
like you, I'm out of clinical, but this needs to happen. And I hope that when I'm in the care of others, there's going to be a collaborative effort to take care of my entire body.
Exactly. Our patients still need us, and they're not all in the dental office. So this is really our way of taking care of the people that need us.
Thank you again, Jamie. We'll talk soon.
Thank you very much.
Cut. It recorded.
All right, good.
Woo! It's just ridiculous. Like, seriously.
It happens.
I have a little bit of time of me just going, like going over here, fixing stuff and